Production funding for this program is made possible in part by the WKNO Production Fund, the WKNO Endowment Fund, and by viewers like you. Thank you.
They seek to reclaim the church's biblical commitment to body and spirit. And you could say they're moving cross town. I'm here with the CEO of Church Health, and it's time for a conversation with Dr. Scott Morris. Before we get into all the new excitement going on right now, I want to back up and start because you have a pretty amazing past when you look at born in San Diego, Virginia, you've got Yale there, you've got London even, so you've been literally all over the world, but give us a little bit of context in terms of how you grew up and how you were formed to be able to do the work that you're doing. When did the light bulb click on?
Yeah, I was born in San Diego. My father was in the Navy. He was a Navy pilot. He was actually shot down over North Korea. Wow. But then he and my mother were from Atlanta, and it's really, I grew up in Atlanta. Growing up in Atlanta, I was always interested in the church, but the thought of preaching 52 sermons a year sent shivers down my spine. It still does. I have no idea how anybody could do that. But I read the Bible, and a third of the Bible has to do with healing the sick. And yet we seem to have lost a vision for how we connect our bodies and our spirits within our faith communities. And that's true no matter what your faith position is. So I started asking, how could I be professionally involved in the faith tradition without having to preach every Sunday. So that's where I went to college, I went to seminary. One day I was in the chaplain's office at the Yale Medical School. I look on his desk and there was a little pamphlet that said, how to start a church-based health clinic. And I go, that's it, that's what I want to do. And I came to realize there were a lot of people who care about this link between faith and health. And so I finish seminary, I go to medical school, I do my residency. I'm ready to start my own church-based health clinic. I want to stay in the South. I didn't want to go back to Atlanta because it had gotten to be too big. And I literally, not making this up, read somewhere that Memphis was the poorest major city in America. And based on that,
you chose to come to Memphis.
Based on that, I said, I'm going to Memphis. I did not know a soul. Came here selling out of an empty cart. To start the Church Health Center at that point, now Church Health. I went to the most obvious place for funding, a Jewish family foundation. It was the Plow Foundation that gave the first dollar to start the Church Health Center, Church Health now. And I think it's incredibly reflective of who we've always been. Paul says we see through a glass darkly, and then John Wesley, the founder of the Methodist Church, says, if your heart is like my heart, then give me your hand. And that's how we've always worked.
Well, and when you look at it, starting with the church, but always having the driving force be the health, the spirit, and you yourself, it's not just that, it's also food. It covers a very wide spectrum, very holistic. So you mentioned the rebrand a little bit, but when you look at going from Church Health Center, how you were known for so long, to now just Church Health, a big part of that is removing the center because now you do so much more than just a physical base program. So give us a little bit of a context there in terms of some of the growth and development, and then we'll dive into some of the real programs.
Yeah, so what people in Memphis know us for is what we continue to do, provide health care for people who work in low-wage jobs who don't have health insurance. But believe it or not, the Affordable Care Act has not put us out of business. I'm only halfway joking about that. It's actually become challenging for many ways. There are still probably 100,000 people in Memphis who have nowhere to turn to for health care. Many of them are immigrants. My opinion is you're building a house in Germantown, you fall off the roof and you break your arm. I don't think we should ask, for your social security number before we help you get better.
So regardless of ethnicity, regardless of socioeconomic level, you want to help.
And those people come to us. More than 50% of our new patients these days, actually, their first language is Spanish. And we are proud for that. We believe that the church and people of faith should open our arms and doors. People forget that Jesus himself was an immigrant at one point. So that piece of what we do is solid. We've expanded our dental clinic from 9 dental chairs to 24 dental chairs. Because in 2,500 pages of the Affordable Care Act, the words adult dentistry do not appear, not in there. And yet giving people their smiles back actually gives them the opportunity to get a better job.
Right.
And in this city, that matters. But there's so many other things we do. We run a preschool called Perea. Our move to Crosstown was as much a move to Perea because Perea was the place where Jesus was when he said, "Let the little children come unto me." And we have moved within a mile of our preschool, within a mile of one of the poorest neighborhoods in Memphis, and being at Perea, where the children come unto us, that is what we stand for. But you are right. There are these other things that Church Health
Right. I mean, you have a
does.
national, even international reach now with
Right.
the newsletter and all the things that you do to share information, to share the lessons learned. So let's dive into some of the programs because I think you do a lot. And so for those that are viewing, to kind of dive into some of the pieces is really important to give some clarity for what all you do. So talk about the wellness side, the actual physical centers where people can come in and receive treatment. And even the way you do it is so remarkably different. But let's talk about the centers and then we'll dive into the way you do it.
Yeah, well, one of the things that Crosstown has made happen is our partnership with the Y. Church Health Y is such a cool thing. All the things that people know the Y for, that is all available. But you lay on top of that our focus on what we call the model for healthy living, which you've alluded to this already. I mean, being healthy is not about the absence of disease.
Right.
But being healthy is about helping people live the life well lived, which we believe comes down to 3 things: having more joy in your life, having more love in your life, and from our point of view, being driven closer to God. If those things aren't happening, then what's the point? But working with the Y allows anybody who's a part of Church Health Y to have access to every Y in Memphis, every Y in America. It allows us to work with the Y over our view of what being healthy means. We focus on what we're actually pretty good at, which is helping people change behaviors, nutrition. We absolutely believe that food is medicine. What a novel idea.
You have to eat right to be healthy.
You are what you eat.
Right.
That thing your mom told you is actually right. The also is true you have to move. You may have noticed that Jesus walked everywhere he went. And,
Right. But talk about the partnership because you have the kitchen, you also have the ability to train families. So many who grow up who don't really, one, have even access to fresh fruits and vegetables, but 2, they don't really know how to cook them. And so you have the ability to train families to be able to cook healthy meals, to exercise is a piece of that, but then to have the nutrition, and then we'll dive into the health. So talk about the nutrition
So
side.
I think the unifying factor of Crosstown is actually food. There are some incredibly cool restaurants there. The kitchen next door that Kimball Musk is running is a world-class restaurant. But I think Kimball would tell you he cares more about addressing the issues of food deserts in Memphis. I know his partners do. But Memphis Tilth, hard to say, I'm not sure how they got that name, but these are all the various food entities in Memphis working together. And it centers out of the kitchen within the Church Health Center. Within our kitchen at Church Health, at Crosstown, every food entity in Memphis is now working collaboratively to try to solve our problems. It's an exciting thing to see happen.
Absolutely. Let's talk about the actual, what you're really known for is the health centers. So
Right.
talk about the health, because, you're talking about 70,000 that depend on you.
Right.
And when you look at even the way you're structured, with a lot of it being volunteer-based, it's absolutely phenomenal what you put together. So talk about the actual medical, the health center side of it.
So we now have at Crosstown 62 exam rooms, pretty exciting. We used to only have 23. We have our 12 staff physicians, myself and my partners. This is our full-time job. We have 1,000 doctors who volunteer with us. One of the things I could have never anticipated, though, is our retired doctors, people who have been the best doctors in Memphis. We currently have 63 subspecialty clinics that are staffed with retired doctors, people who go out and play golf for 6 months, then their spouse calls me and says, can't you do something with them?
them to work.
we put them back to work. And then on the other end of that, we've now started a family practice residency in partnership with Baptist Hospital. And everybody listening to this ought to care, because we are almost certainly training your doctor. Young doctors who will be primary care doctors in Memphis, who are learning the Church Health Center way, focused on prevention, focused on realizing there's a spiritual dimension to life, realizing that the impact of community is powerful. It's not just about giving you another drug.
And I want to take that a little deeper, because, I mean, just think about this. Being immersed in the culture and not only getting the training, but understanding the ties between the food and knowing how to help and where to push them to get those resources so that they're eating right. But then also, to your point, not just taking care of the medical side and prescribing medicine, it's actually stepping into the spiritual and helping them heal their mind as well, that carries the full benefit. So in other words, if I'm just sick and I try to fix the illness, I'm maybe not fixing the whole body that needs to be helped as well.
Yeah, so first off, 50% of people who come to primary care doctors like me have no medical problem. But people come to the doctor today for reasons they used to come to the pastor. It's all complicated why. But we build everything we do off of a passage of Scripture that says, you are the children of God, therefore, as God's chosen people, holy and dearly beloved, clothe yourself with gentleness, kindness, compassion, humility, and patience, and above all put on love, the harmony which binds all. Those virtues are what make life worth living. You know, that is not what you normally hear in the doctor's office, but gentleness, kindness, compassion, humility, patience, love. That's what makes life worth living. So everything that happens at Church Health is driven by, how do I engage a person to make those virtues come alive? Our model for healthy living grows out of, how do we have these things that are fundamentally of a spiritual nature?
I just think it's remarkable to know that you're training the future family care physicians and doctors. And, you know, even going back to the way you've set this up, being volunteer driven. I mean, think about that for the community, for the cost savings. And that's how you're able to do what you're able to do. Right. On a very small budget. And you become one of the largest organizations nationwide doing this, which is impressive when you look at just the Memphis model that you've created. It's remarkable. Talk about just, you know, the heart that you see for these physicians that come in and volunteer. I think that's a big statement, to come in and volunteer their time. And you've even built out specialists. So in other words, if someone has a very difficult situation, you have the go-to team to hand them over and say, we'll help you out. We'll take care of you.
So one of the things I am actually very proud of is that over the years now, for 25 years as we speak, we've had young future doctors who are taking a gap year. They finish college, they want to go to medical school, they work for us. We now have over 900 of them who go on to medical school. I sit down with them and ask, why do you want to go to medical school? Well, they try to be creative with their answer, because what they want to say is, I want to help people. That's why they want to be doctors. Right. I want to help people. Now, unfortunately, what happens along the way is that other things interfere, and they may, you know, see the financial side of this. They, I believe, fall in love with the technology of this. You know, I'm absolutely certain in medicine, and I think in America, we have an unholy love affair with technology. You know, but in medicine, you know, the technology is not that good, and truthfully, the doctor is not that smart. God gave us our bodies for a reason, and we have an obligation to take care of it. So what happens is that those doctors still want to help people, and what Church Health has done for these 30 years or more is reach in and give people the opportunity to give back. We have found a way for them to be the type of doctor they always wanted to be. And people have always said to me, oh, how do you get doctors to volunteer? Well, we get them to volunteer because we give them the opportunity to be the type of doctor they always wanted to be.
I love it. And I think it's, when you look at Memphis always being one of the most philanthropic giving cities, this is the perfect place to have this created, this new model. This, I love it. So we've talked about food, we've talked about health, we've talked about wellness. you actually take it a step further and you work with churches. And so you have clinicians that go in and work with churches. You're training volunteers to work with churches. And so you've really stepped out of even those walls to dive into the community. Talk about the community collaboration aspect.
Well, so there's two things that really reach outside of Memphis that I would say most people don't know we do. One is we do publish a magazine called Church Health Reader. It is about trying to help a congregation in the middle of Iowa that wants to create a health ministry and connect them with a congregation in Seattle. It's been powerful to watch how these things happen. The other thing is we're the home of a concept known as faith community nursing. Nurses working in churches. The Westberg Institute lives at the Church Health Center. So what does that mean? We have created a curriculum that trains nurses how to work in a church. It's approved by the American Nursing Association. It's used by 148 nursing schools around the world. There are 18,000 of these nurses around the world, 15,000 in America, 3,000 internationally. They look to Memphis. They look to Memphis, to Crosstown, to say, how do I do this work? The Church Health is their inspirational, maybe argue spiritual home. And it's been one of the more exciting things in my career to get these nurses, because once you give a nurse a bone, they will not let go of it.
Nice. So we've been talking about it throughout Crosstown, and when you talk about Crosstown Concourse, you know, very large complex. And I know even for you, what sold you was actually going on a trip and seeing another one in Minneapolis and how they brought that one to life. And that's where it kind of, the light bulb came on, that we can do this. We can come to Memphis and make this happen right here in our own backyard. Talk about the journey to get to this point, right, to open Crosstown, and really what that means is the next chapter for Church Health.
Look, the vision for what became Crosstown begins with Todd Richardson. That nobody should ever say otherwise. You know, Staley Cates is both generosity, love of Memphis. Doesn't happen without that. Todd and I meet, and we have a small conversation which turns into a very big conversation, which means the Church Health Center at that point is going to move entirely to Crosstown. But then this was a huge move, you know, small $200 million project. Did it really make sense? So we were able to find the resources to take 3 private planes, including Mayor Wharton at the time, to Minneapolis to see the Crosstown redevelopment there. That building is very similar to ours in that it was in a very distressed neighborhood, once known as Murderopolis, but the building had completely changed that part of Minneapolis. It was vibrant, it was alive, and I think every person on that trip came back saying, we can do this.
Because it's like a vertical village. I mean, even in Minneapolis, you had shops and you had apartment space, and so you had this kind of livable village where you had a little bit of everything. And so all of a sudden you say, wait a second, we can do this right here in Memphis.
And we could do it a Memphis way.
Right.
You know, and really the cool thing for me, this whole thing has been driven by artists. You know, this is a vision of what is possible. Without the artist, I don't know how we get there. You know, I think our partnership with the artist early on helped us get to the next level. But yeah, this is a vertical urban village built around art, education, and health. The education component is critical. We know that from what we do, and that the number one predictor of anybody's health outcome is actually your education. So if you don't have an educational component in whatever you're doing around health, then you're probably not going to get there.
How much of the overall square footage is taken up by Church Health?
Yeah, so the building was originally 1.5 million square feet. Just to put it in perspective, larger than the Chrysler building, more than 2 Clark Towers, 37 football fields.
Wow.
It was big. It became 1.1 million rentable square feet. That was these ginormous atriums in the building are how it creates light and it gives you the feel of grandeur that the building has. So of that rentable square footage, the Church Health occupies 150,000 square feet. So a little over a tenth of the building. We are the largest tenant in the building, and I'm happy to say right in the center of the building, because
Nice.
I think much of what we do is at the heart of what Crosstown's all about.
Well, and you alluded to, you have the kitchen, so you have restaurant and food, then you have education and schools, you have apartments and maybe even condos, but definitely apartments where some of the physicians and the residencies, doctors and residents will live. So it's pretty neat to see this urban village, this vertical village, all coming to life and all alive.
Yeah, I really think the apartments are the magic. 260 or 5 or so apartments that, for me, it's all about the young future of Memphis. So young doctors, young artists, young educators, young lawyers, young business people living in community, people who care about our city, who want to make a difference. I think it is about the brain drain that has been a terrible thing from Memphis, but giving people's children and grandchildren an opportunity to come together and say, what if? What could we do? How could we change the city for the good? And here they're living in an environment that is doing that very thing.
Absolutely.
I have joked, only half-heartedly to be honest, that I want to be their mother, meaning that I don't want to really tell them what to do. If I see them going over a cliff, I may say maybe that's not the direction to go, but beyond that, just give them the opportunity to be together and then step back and watch them make incredible music.
You've accomplished so much with Church Health already. What's maybe one either proud moment or something that when you look at this legacy that you're creating every single day, what puts a smile on your face?
Look, it's all about people. It's the people that I've had the enormous privilege to get to know as being their doctor, people who, it dawned on me one day that many of my older patients are actually Martin Luther King's age. That these were people who truly were there during the garbage workers strike, and how they have survived in remarkable ways, and I've gotten to know their stories and been a part of their lives. That is what makes me excited even today. But on the other end, seeing children at Perea, our preschool, grow up. A few years ago, we had a graduation for our Perea preschool, and our very first kids were graduating from high school.
Wow.
Now, we invited them to come back to their preschool graduation. Would you have done that? I don't think I would have. More than half of the kids actually showed up. And the boys were wearing ties. Nobody told them to wear a tie.
That speaks to the relationship you've created, though.
And most importantly, almost all of them were going to college. I don't think that happens without their getting started with Perea, and most importantly, how we work with their parents to help them become better parents. And yes, that excites me at every turn. And then now, our residency, young doctors learning how to do it better, learning that it's not about the absence of disease. Being healthy is about giving people hope for the future. I see it every day. To be honest, they exhaust me.
Got so much energy?
Yeah, their energy and they are
Their
sponges
enthusiasm?
for knowledge. I mean, they want to learn. They want to do it better. And again, everybody in Memphis should care, because this is going to be your doctor. I feel fairly confident, because part of the deal, we're not going to pick you to be in our residency if we don't think there's a reasonable chance you're going to stay in Memphis.
Nice.
You come to us, and I think you're fantastic and you're wonderful, and you tell me you're planning to go to New York. That's a non-starter for me.
Well, it goes back to keeping the talent right here. So you become a talent attractor and also a retainer and a developer. So you cover all spectrums: talent attraction, development, and retention. So what's next? I mean, obviously, once again, you've got so much momentum. You've got so much going on your plate. What's maybe one thing that you're really looking for as the very next chapter? What's something you're building toward?
Well, so we've formed a partnership, which is really cool, with Tulane Medical School around something known as culinary medicine. Food is medicine. How remarkable, The fact of the matter is, this whole idea was started by a guy named Tim Harlan, who was a successful chef in New Orleans, goes to medical school, learns, hey, I didn't learn anything about nutrition while I was in medical school. So he develops a curriculum to train young doctors, medical students, doctors in practice about how to engage their patients around eating better. And that curriculum we have now adopted at Crosstown, taking it not just to the University of Tennessee Medical School and to doctors in Memphis, but all over the country. And we do that in our kitchen at Crosstown in partnership with Memphis Tilth. All these people who are trying to address the issues of food deserts in Memphis.
Nice.
I believe that we can do truly remarkable things by working together in partnership. So the next thing for me and for Church Health is about how do we expand these partnerships? It's not just Church Health. It is about how we work together collaboratively to make a difference, make the world better. I'm still
Well, that's the perfect way to tease everyone and say, hey, for collaboration, how do they reach out to you? So tell everybody where they can learn more. How can they follow the conversation? How can we get involved with Church Health?
Yeah, so our website is churchhealth.org. We're all over social media, but if you just Google Church Health, you will find us. And come. If you haven't been yet, come take the tour.
Take a tour.
We have a welcome center at Crosstown that is not just about the Church Health space, but about the entire building. There are so many unbelievably powerful stories. The artists are out there telling the story every day. Memphis Teacher Residency, engaging young teachers over staying in Memphis, making education better. I think most people have no idea that inside this building is truly a cauldron of creativity that is going to change our city for years to come.
Well, Dr. Morris, thanks for all you do, for coming on the show and sharing it, and definitely look forward to having you come on continually many more years to see the legacy created. So thanks for all you do.
My pleasure to be here. We love Memphis.